Tonight, we continue an important series right here at News 5. It sheds light on a multitude of issues surrounding pregnancy. It's called Delivering Better Results. And Courtney has been working so hard on this for weeks, months now. It is so good and worthwhile.
Oh, well, thank you, Rob. It's a really important issue, Rob. And tonight we're talking about keeping babies and their moms alive. And I've been telling you about the challenges Black mothers face as they work to carry their babies to full term. But look at this. Here in Ohio, nearly 7 babies out of every 1,000 born will die before they even have their first birthday. For Black babies, that number is 2 times worse. Nearly 14 out of every 1,000 babies born in the state will die. But it's not just those babies. Moms are at risk too. The CDC says more than 21 mothers die for every 100,000 births in our state. And for Black mothers here in Ohio, the reality is even more grim. Deaths soar to nearly 30 per 100,000 births, according to the Ohio Department of Health. So what can be done to make things better? I went in search of some solutions and found a group making a real difference.
I love to refer to myself as the poster child for child loss.
For more than 21 weeks, Samantha Williams Pierce carried her twin boys.
And I'm telling her what's going on, and Carol's like, yeah, Sam, I think you need to come in and let us take a look at you.
But in July of 2009, she lost her baby boys after she started leaking amniotic fluid. At the time, Sam was the COO of a local nonprofit.
I'm running basically a budget of almost $1 million, and that's high stress.
Little did she know, Sam had several strikes against her when it came to being able to successfully carry and deliver a baby.
And I was actually at a conference where they asked, who do you believe is the worst risk? It had like different answers, and one was a PhD prepared Black woman. Would you believe she has the highest risk?
Dr. Heather Rice is an associate professor for the School of Nursing at Cleveland State University. She's also a nurse practitioner. Since 2019, she's been researching the factors that contribute to healthy outcomes when it comes to Black expecting moms and their babies, and those that don't.
We know that African American women experience toxic stress at an increased level, and that causes the body to experience more of these concerns related to hypertension, glucose being elevated, and the things that cause those adverse outcomes after delivery.
What are some of the things that play into toxic stress?
Well, that's a great question. So toxic stress is experienced at increased rates for Black women specifically because of systemic racism.
Systemic racism is the single factor that pervades the everyday lives of Black women. Unequal pay, unbalanced educational systems, implicit bias in healthcare, and microaggressions at work. And this level of toxic stress not only impacts the mother, but the child she's carrying.
And in terms of the infants, we notice that prematurity is that driver, but it's directly connected to that toxic stress that the mom is experiencing during pregnancy.
Dr. Rice also tells me this is one area where socioeconomic status does not matter. No matter how much money or access a Black woman has, she's still susceptible to these higher risks during pregnancy because of institutional racism.
We even see with celebrities such as Beyonce and Serena Williams, they also felt during their pregnancies that their voices weren't heard, they were not acknowledged.
As for why the numbers are so high in Cuyahoga County, Dr. Rice points directly to the 2020 Project Noir report that ranks Cleveland as the worst city for Black women.
Moms really reporting similar situations and incidents that are also mentioned in that study that came out. I believe there's a correlation of what they experience.
The research Dr. Rice is doing is in partnership with the Cleveland nonprofit Birthing Beautiful Communities.
So our organization was created to ensure that babies were able to make it to their first year.
When BBC was created in 2014, Jasmine Long, the current director and CEO, says Black babies in Cuyahoga County made up 73% of infant mortalities under 1. But with a staff of about 37 doulas, Birthing Beautiful Communities has shifted focus, making things better for expecting moms.
It's that familiarity It's the support system. It's the having someone be your advocate in the room with the doctors and nurses.
BBC doulas not only advocate for moms during appointments and in the delivery room, they even provide out-of-the-box services like grocery shopping and transportation for that mother until her child reaches their first birthday.
It's very evidence-based, the role of doulas, specifically community-based Black doulas, working with other Black women to provide these kind of services as a tool to reduce infant death and maternal mortality.
In fact, of the 1,000 families this organization has touched over the last 9 years, there have been no maternal deaths. And Long tells me they have a 99% infant survival rate. Remember, I told you when BBC was created, Black babies in Cuyahoga County accounted for 73% of the infant mortality rate. The County Board of Health now reports that number has dropped to 56%.
So for myself, that said, you all are doing something so special, so unique, so great. Let's look at what's being done, how it's being done, so it can be replicated.
Leaders at BBC feel so strongly about the services they provide, they do it all for free.
Because the more we address the stress, the more we notice that the baby, it improves for the baby and for the mom.
This is our community. We weren't going to sit idly by and just let our babies and moms keep dying, that we were going to figure out how we could have an effective solution to solve this issue.
So I asked Dr. Rice and Jasmine to tell me 3 things a Black woman should do once she finds out she's pregnant in order to improve her outcome. I'm told to find a doula, find a medical provider who makes you feel seen, heard, and respected, and be informed about both your medical history and the risk involved in your journey. Now, we will be exploring many other challenges surrounding pregnancy in our new series, Delivering Better Results. Just stick with News 5 for more in the coming weeks.
Wow. Okay, a lot of things here. Beautifully shot, edited, most especially written.
Thank you.
Your people, real people in that story are strong. The experts are strong. The numbers are startling. But put all of that aside, and what really stands out is how much you cared about it.
And I care because I'm a Black woman that's been pregnant, and I'm a Black woman who lost her mom to maternal mortality when I was 15 years old. So this is really something for me that it really touches my heart. It's close to my heart. And I'll tell you, when I became pregnant, I was horrified. I was scared. I was very scared because I knew the statistics and I knew what happened to my mother. So that's why I wanted to explore what's happening here and see what things are looking like and show it's a real problem. But there are some possible solutions out there that we really need to be paying attention to.
Well, you succeeded and then some, and we can't wait to the series to continue. Just
Thank you.
Fantastic work.
I'm excited about it. Thanks so much, Rob.